I think there are a lot of things that the health department does that nobody knows about. I always say when things are going really well, you never know that we're there.
Public health is so important, and we know that more than ever coming out of the pandemic. And if we don't provide good preventive health and health maintenance, then we're left with dealing with the consequences.
Because public health really is everywhere. We do a lot of things that a lot of people don't know that we do.
I think public health, it encompasses so many aspects. Any type of healthcare or any kind of issue that impacts the overall health of the community falls under the umbrella of public health.
There's all of this other area of health that is really important to recognize because we all are playing a role in keeping people healthy.
A public health externship is really designed as an immersive experience for students to get out and do what is being carried out, in this case, in our county health departments. So the public health externship really is brand new this past year. So in the past, we had some sort of one-off type experiences where a very interested student could sign up and spend some time in the public health area, but we really lacked a formalized process for students to go out and really see everything that's done in a local health department. So one of the most interesting things I think that has come out of the externship so far from our student feedback is their amazement of all the things that happen in a county health department. I think the awareness of what county health departments do, and then the thoughts that go through these students' minds that maybe someday I would want to be part of a county health department to be able to improve the health of the citizens that I'm serving.
My experience with working with the local health department in Allen County was not at all what I expected it to be. I had never had a public health experience before, so I thought, I'm always looking for opportunities to get out of my comfort zone and do something I haven't done before. And so I thought it would be a really interesting experience to live somewhere else in Indiana and just see what it was like to work in that, sphere of healthcare.
Honestly, when I learned about it for the first time, for me it was a no-brainer. Before medical school, I did a master's in public health and did a year of service as an AmeriCorps Vista. But for me, one thing that I felt like I hadn't gotten was sort of the level of a health department.
I thought the public health elective was an opportunity to do something a little different with my fourth year. It gave me a little bit of time to adventure outside the hospital and still retain some clinical credit, which was really nice.
The first day was when she told me that I'd be going to jail twice a week, to the county jail to do STD testing. So I thought, wow, I really wanted to go out of my comfort zone. I don't know if this is how far out of my comfort zone I wanted to go.
I would go in on the weekdays during business hours and just kind of do almost a day in the life of whoever I would be working with for that day. So I would work with just the various staff and faculty at the health department, whether that be the folks that did the needle exchange or the school nurses or just various volunteers.
I worked with health inspectors, kind of going around the county, looking at restaurants and investigating environmental health complaints. I was able to learn more about the Ryan White grants, which fund a lot of programming surrounding HIV/AIDS in Indiana. I even got the opportunity to go to some meetings with the county health officer.
I worked with some incredible staff and faculty at the Allen County Health Department. They were so welcoming and wonderful and truly integrated me into the team at the health department.
The staff that I got to work with at the health department were honestly part of what made the experience so wonderful.
All the students we have had have been great, and they've all brought something different to us.
I think the experience for us here at the health department has been surprisingly great. We've been very lucky. We've had excellent students that are just really great representatives of the program, but also, I think having a student, it brings a fresh perspective to what you do here.
We want the best and the brightest to be going into public health, and we want to expose people as early as possible in their medical careers.
This elective is very different from the traditional clinical setting. It's an immense educational experience. During this rotation, students get an understanding of social determinants and how they affect the health of individuals. By learning these, they become more engaged when they see the patients at a later date.
But we kind of talk with them the first day and sit down and see what is your specific interest level. And then we kind of tailor that experience to them and what they're hoping to get out of the rotation.
Immunizations, STD, doing food inspections, refugee health care. We do a lot of things that a lot of people don't know that we do, and things that they will come across when they are in practice.
There are really no boundaries to where we offer clinical services, so it really helps give them a well-rounded experience with different opportunities to serve people in need.
It's been a great experience for us as a health department, and I think our students have had a great experience, and we hope to continue to build that, and we're always open to feedback and constantly looking to make this elective better.
So if a student was to ask me, what about this public health elective? Should I do it? I would say absolutely yes.
I think every student should take this elective.
I would absolutely recommend this elective to my peers.
It is definitely worth your time and effort.
It's amazing for medical students to have these sorts of experiences very early on.
My dream would be that all students have to take this elective. I think to be a practicing doctor, it's very important to understand the partnership you should have with your local health department.
It was just such a unique, really, honestly life-changing experience, and I don't say that lightly. I really do feel like it was a life-changing experience for me.